I think God gave me a built-in microphone. If you want me to use the microphone, I'll use it, but I don't think I need it. Esther came to me 2 weeks ago, and she said, Gary, would you come and say a few words? And I looked at her and I go, oh God, Rotary. I mean, I love coming to Rotary. And I thought, I'm really good attendance lately, without being a member. But I also feel that a lot of you Rotarians, some of my board members are here, many other Rotarians, you know a lot about the Community Foundation. Okay, so I asked Esther, I said, Esther, what do I talk about? It's not about fundraising, not about funds, not about different things like that. And she kind of scratched her head too. So I was at an event the other day, my son turned 18, and we had a lot of friends over, I know. And a few of them were Rotarians in San Jose. And I was telling them, I said, I'm coming to talk at the Rotary about a Community Foundation. And they kind of looked at me and they said, well, what do you do, Gary? I mean, truly, these are friends that I've known for 30 years, since before my son was born. And I said, it's good. So we sat down, of course, we had a few drinks. So I said, well, tell me what you do know. And they knew very, very little. They thought I was at home for the whole pandemic, So I shared a few things, and at the end of it, one of the guys said, that's what you need to tell them, So I'm going to take a totally different approach. So when you think, and I don't want my board members to say this, when you think of the Community Foundation, be totally honest. What's the first word comes to mind?
Gary.
Okay, me. Who else? What else? Give me a few words.
Charity.
Pardon?
Charity.
Charity, okay. Philanthropy, another word for charity, okay. Organizations. Nonprofits. Training. Any other, don't be, if there's negative connotations, one of the people said, I haven't a clue what you do.
New building.
New building.
Epicenter. 400 block.
400 block. Grants. Thank you, Anne.
Interest.
Pardon?
Interest.
Interest. What's that mean?
Because of the dollars that make interest.
Oh, okay. So, when the pandemic struck, I'm going to talk about your Community Foundation and what your Community Foundation did in San Benito County. I know a lot of people were isolated. A lot of my friends worked from home. I didn't have that experience. The day in March when the governor closed everything down and told us that we couldn't drive more than, whatever it was, 10 miles from home, we were approached by the Office of Emergency Services in San Benito County. And they asked us, they said, Gary, we feel Community Foundation is an essential service. Would you stay open? And in our old building, we were extremely lucky that we all had individual offices. We wore our masks and we did all that, so we stayed open. So I didn't have the experience of working from home. And one of my staff members worked from home for a couple of months, and then she came back, and everybody worked in the office, which was phenomenal. What did we do? Your Community Foundation did something that I have, never done in my life. We were approached by the hospital within a week or so of the pandemic, and they said to us, Gary, there are no N95 masks for our staff. I'm thinking, how can that be? So our hospital had all these N95 masks and the PPE equipment in a storage space, okay? When they went to open it up, it was all destroyed. All the elastics, because of the heat, they all broke. So there was no N95 masks. One of our former board members, he had a daughter in Nashville, and she was a nurse. They were jerry-rigging PPE equipment. They couldn't get it. He went to Stanford, and he had a friend of his who was in China. So he phones up his friend, he says, I need some equipment for my daughter. And he says, okay, I'll get it. So all of a sudden, he gets this 2 batches of N95 masks that he sent to his daughter in Nashville. And then I went to him and I said, Hazel Hawkins Hospital needs it. And then he says to me, Gary, St. Louis needs it. Okay, fine. How do we get it? He makes a phone call to China to his friend. Okay, and this was at this stage, nobody could get this stuff. It was skyrocketing prices. And he came back to me and he says, Gary, we need to wire $18,000 to this strange account. Now, if my board are hearing this for the first time, I apologize. But wired this $18,000, and it truly was a risk. We were ordering 18,000 N95, and here's one of the bags in Chinese, one of the ones that are left over. And we wired the money, we took a calculated risk. will we get this? Then the Chinese government, if you remember, go back 2 years, they closed all exports down. They closed them down. They weren't allowing the exports to leave because they needed them in their own country, and we were left in limbo. Well, lo and behold, 5 days later, DHL arrived at the hospital with about 25 boxes. We split it up between the hospital here and the hospital over there. We gave it out to nonprofits. So that was something that you never thought your community foundation would do. Okay, the other thing was, do you remember we were all trying to get hand sanitizers? Couldn't get them, we were wiped out. So this friend of mine, ex-board member, very intuitive and very smart, his daughter, again, they had no sanitizers in the hospital. So what did he do? He scoured the internet and he found that the company that does the waxes for his RV were starting to make these small batches of hand sanitizers. Here they are, the last one's left. So he was allowed to get online only 4 of them. So he gave me the owner's name, small company, and I think they were in Texas. And I called up the owner and I was very transparent and very honest. I said, our local hospitals need this, our nonprofits need this. Hoviness didn't have any sanitizers for their drivers to go out and deliver meals. Simple little things. And do you remember how scared we were? We were even washing our vegetables and this stuff. You know, it was crazy, we didn't know. So I said to the guy, I said, I know you've got the limit of 4. Is there any chance? He was very good. He said we were able to buy 6 cases. That was the max that he would give us. So he sent me 6 cases, and they're high in, as you can imagine, very high in alcohol. So they came from Texas. They couldn't be flown because they're so high in alcohol. So it had to come UPS. So they came on a weekend in May and extremely hot weather. And this company don't normally make this. So when they came, we got all the boxes, we opened them up. Many of the seals had bust and they had dehydrated a huge amount. Okay, so this was his first time doing it. I was very appreciative. 85% was still there. We gave it out to the hospital, we gave it to the nonprofit, but I took a picture for him and I sent it and I thanked him profusely. I said, thank you very much, but your seals are breaking, you want to do it. What did he do? At no cost, he sent the same quantity of boxes back and he put a new seal on them and a new thing. So we had a huge amount of this that we were able to give out. The other thing that you couldn't get was Clorox wipes. Remember? Clorox wipes. Just couldn't get them. You're in the thing. Everybody wanted the Clorox wipes. Well, we had a contact in the community who knew somebody. Clorox is based in where? Where's Clorox based? Oakland, California. So we had somebody who was on the board of Clorox who knew somebody. They made a phone call for us. Okay, and they said, we are wiped out, we can't get stuff for 6 months, it was just as crazy, Well, then all of a sudden he called my friend back, and he says, he told Steve, I've got you some, but it's in plain boxes and it's not marked, hadn't been labeled yet. So we got a couple of these huge big boxes, we gave them to all the doctor's offices, we gave them to anybody who was dealing with the public, our Office of Emergency Service, we gave them to. And then the other request that we got from the Office of Emergency Service, do you know what we were asked to get? Booties. Okay, simple little booties for your feet going into people's houses. Our EMTs, our fire department and what have you, they couldn't get booties. So we put our heads together. Do you know what organizations has booties in our community? Realtors. Very good. Realtors have it when you go into their house. So we went to all the realtors and we got a huge amount and we gave them out. Okay, so they were some of the small little practical things that we were doing in the first couple of months. And then after that, a group of people in the community got together and they started making the gowns. And what we did was we paid for all the materials. We gave grants out. The other thing that we did when the pandemic hit was give instant grants. Okay, a huge number was for food. Can you imagine food insecurity? We encouraged other organizations outside our county to come in and give us food, okay? We had many organizations giving out food, and then there was a little bit of strife and a little bit of not in my territory, and the Community Foundation was asked to be the mediators of this, and I had no clue. I mean, people talk to me about food insecurity, and I don't know what that means, okay? And they were basically saying, we've got people, kids and adults in our community going hungry every single day. And I had a hard time believing that until I started asking the nonprofits who are doing it, Huge number of people. Then we had a complaint from some of the providers, Gary, we've got too much food in the community and it's going to waste. So I reached out to Willie at the food bank in Santa Cruz, which is this massive big food bank. And he's very wise, been there for years, and they provide all of Santa Cruz County and some of North Monterey County. And I asked him, I said, Willie, this is what's going on. Do we have too much food? So this was his first answer. Gary, you can never have too much food. Food will always be eaten if it's given into the right hands. So I shared with him my problem, and he says, well, you need to there should not be any tensions with food distributors at all. So he said, UC Santa Cruz did a study for him a few years ago, a food insecurity study in Santa Cruz County. We contacted UC Santa Cruz, and I just brought you a copy, they did a huge, in-depth food insecurity study in San Benito County. They looked at all the food that's been distributed. They went by the norms of our populations, the ages and what have you, and they published us a very professional report at no cost to us. UC Santa Cruz Department did the whole thing, and the end result was we still have food insecurity. We do not have an over and abundance. It has been brought down by COVID and with all these other providers come in. So that was something that we did that we never thought. We would never have got into the food business. And the last thing that we did was grants. Gina mentioned we give grants out. That's one aspect of us. Do you notice that none of you mentioned money when I asked when you think of the Community Foundation? How many of you have ever been to a Community Foundation fundraiser? Okay, fundraiser. Tell me what type of fundraiser was it? Yeah. Okay, Rich, do you remember what type of fundraiser?
No, I don't.
Okay, do you know why? It's a trick question. And we all think, Community Foundation has never done a fundraiser. In my 20 years, we have never done a fundraiser. We've had many events, but we've never asked for money. So how do we do it? By the generosity of donors. Individual donors, we get a small fee. You got, Rotary's got 2 or 3 funds with us. We get a small admin fee on that. But we're very different than the other nonprofits because we feel we're there to support all 175 nonprofits. We don't want to compete with Esther's fundraiser. We don't want to be here selling tickets. We don't do that. We haven't done that. We might down the road have to, but we don't. We do a lot of informational, we do a lot of events, but they're all to do with information. How can you help the nonprofits in your community? So that's what we do. But one thing during COVID was, for the very first time, we had outside agencies phoning us up and giving us money. That never happens. San Benito is an island. And one of our difficulties is that we're a population under 100,000, and a lot of the big funders do not fund San Benito County. They all think we're San Bernardino County. They fund San Bernardino, they don't fund us. But during COVID, we had some of these incredible nonprofits in the Bay Area phone me up, Gary, do you need funding? And of course, you're going to say yes. We were able to fund. We normally give out unrestricted grants of about $250,000 to $300,000 a year. We gave out during the COVID period of time, 3 granting process, nearly $1.5 million. Phenomenal. It really was absolutely phenomenal. And I'll tell you a small little story. I had an acquaintance of mine that I know. He works with affluent donors in the Bay Area. Okay, he phones me up. He says, Gary, I have a donor who wants to give a donation to the Community Foundation for COVID relief. I said, great. Who? Can't tell you. Not going to tell you who. I said, well, what do you mean? They don't want their name be known. Okay? He sent a check for $100,000. $100,000. Now, it came from like a donor advised fund, but it wasn't. It was private. I did all the research I couldn't find out. Still don't know to this day. After about 3 or 4 months, the guy phones me up and says, Gary, have you spent it? And I said, every penny. Sent him a report, all the nonprofits, okay? Phones me up again 3 or 4 months later, do you still need money? That same donor sent another $100,000. And I still to this day have he said, no, they like the county. Do they live here? Can't tell you. Give me no information whatsoever. You know, so that's what your community foundation does. We advocate for the nonprofits, and we try to keep philanthropic dollars in our county to benefit our locals. I'll share one last story, and then I'll just take questions. About 10 or 12 years ago, we were in the old Shelton building upstairs. I was in a small little office. You know, I'd actually say longer. I'd say it's about 16 years ago. Not that long in the position. And really, in the early days, Phil will tell you, we didn't know what we were doing. We were learning. We were learning what a community foundation was. So I had this elderly gentleman walk up the stairs, knocked on my door, never saw him before, and he says, Mr. Byrne. I said, oh, that's me. Wow, I got promoted. He says, can I come speak to you? So he comes in, sits down, and he's in his 70s, and he says, I just want to let you know, sir, that I've just come from Mr. Dave Pipel, one of our attorneys in town, and I'm leaving my entire estate to the community foundation. Now I'm sitting there going, holy, what does this mean? And more importantly, why? We're not well known, okay? Why are you doing this? Well, here's his why, and I've shared this before, so he wasn't born and raised here, but he spent the last 25 years here. He had an elderly mother. She died in Maybes, okay? Never got married, no kids. So he's doing his estate plan. He wants to give it to somebody. So his first phone call was to Hazel Hawkins Hospital. This is years ago, okay? He phoned up the development person there, no return phone call, okay? So what does he do? Like a good donor, goes down, knocks on the door, nobody there, he meets somebody, he leaves his name and number, no return phone call, okay? Yeah, but this happens. Okay, then, you know, he's made up his mind, okay, you know, they're not returning my phone call. I could die tomorrow. I need to set my estate up. So he makes a phone call to the David and Lucille Packard Children's Hospital. Okay, the development person there, oh, Mr. So-and-so, we'd love to have you come on up for lunch. Came up for lunch, had a beautiful tour of the building, and he sits down with them afterwards, and they're very professional, and they sit down and said, Sean, how much is your estate worth? I would never ask that question, never ask a donor that. But this beautiful woman did, and Sean answers, my estate's worth $7 million, okay? For me, huge estate. Her response to Sean was, Sean, thank you very much, that's very generous, but you know, we can't name anything after you for that. And he's telling me this in my office, and I go, oh my God, that's the wrong question. This man is extremely anonymous. He does not want anything named after him. And he walked away with the impression that his $7 million was going to make very little difference at this beautiful hospital. So he came back to his attorney, Mr. Pipel, and he says, hey, I want to leave it to something local. And Dave knew about the community foundation. So he set up a fund, listen to this, to benefit the elderly in San Benito County. So whenever, you know, that person passes away, just say it's $5 million today, it'll go into an endowment. It will create $250,000 every year for the elderly. Okay, so let me fast forward it. We become good friends. I go to his house many times, have a cup of tea, this whole thing. And then a few years later, he comes to me, he says, Gary, I'm now Gary, not Mr. Byrne. He says, I have a big favor to ask for you. Would you officiate at my wedding? And I go, oh my God, you're getting married. And my first thought was, there goes my donation. I hate to say it, being crass. That's what you think. Come on, you are all thinking the same thing. There goes my donor. Some damn grandkids are going to get it, you know. So he's just an incredible human being. And he said to me, Gary, just let you know, this is an old friend. I got to meet her eventually because I did do the facilitating of the wedding. And he says, she's got her estate plan, I've got mine, nothing is changing. And, you know, I didn't say, whew, but, you know, so fast forward many years. They're happily married, a wonderful, now at this stage he's in his 90s, okay? She's in her late 80s. And this summer, I was home visiting family in June. I come back and what do I look at first thing is the obituaries. And I see this person had passed away. Okay, so my heart is, you know, sad. There was no services because, you know, COVID was over, no services. So I pick up the phone and I call the wife and I give my condolences from the board and myself. And I said to her, I said, listen, I'd love to come over and have a cup of tea with you. And she was very hesitant on the phone, and I'm thinking, why are you hesitant? I know you. You know, and then she said, oh yeah, well, why don't you come by after work? So I go by after work, okay? I'm out on the doorstep, and I'm thinking, why am I not being invited into the kitchen for a cup of tea? So eventually I'm invited in, and what have you. And we're sitting down, and she says to me, she says, I suppose you want the keys. The house is in the estate, and he never told her. So she's there, and I said, no, honey, you can live here as long as you like. I said, your husband and I, you have a life estate. He never told her. Wow. He just presumed that she knew that. She thought I was coming to get the keys and evict her. No wonder she didn't want me in the house. She was totally relieved, you know? And then I come back the next day to work, and she calls me over and she says, Gary, we're having a service such and such, and I want you to speak at it, you know? So but that gift is going to stay in our community, and it's going to benefit our elderly. So that's what your community foundation does for you in our community. I'll stop there. I was told 10, 15 minutes. Questions?